All right, so we will begin. Well, I want to welcome everyone to the first annual Michigan Moves Month webinar and the first annual Michigan Moves Month. I know this is certainly a labor of love for a number of people that are on the webinar today. And we'll be very respectful of everyone's time and be prompt. I just want to have a couple of housekeeping notes before we dive into our conversation today. So first off, this is Zoom webinar, so we cannot see you, but you can see us. There is the Q&A feature that you should see through your Zoom window that will allow you to ask questions. Certainly feel free to ask questions throughout. I'll be moderating those questions. If it's appropriate to ask that question at that point, I will. If not, we'll wait till the end. We may answer some questions in the actual Q&A box rather than verbally. Rest assured, if you do have a question and it cannot be answered during the webinar, we'll follow up after the webinar. Now, I will say that this conversation is squarely around physical activity and how we can collaborate together to make Michigan a more physically active state. And so that's the scope of the questions that we'd like to keep that to. I'm reminded of that because when I tried to promote this through Facebook, they told me the ad was political and they would not promote it. So I said, physical activity is about the most apolitical thing on the planet. So we're going to keep it as such during this conversation. Without further ado, I want to start the conversation just first by laying a little bit of context and then by having our panelists briefly introduce themselves, and then we're going to get into this conversation. So first off, my name is Michael Stack. I am a board member of the Michigan Fitness Clubs Association, as well as a fitness facility owner here in the state of Michigan and a faculty member at University of Michigan School of Kinesiology. I will be moderating and setting some context. And the context here, I think, is quite simple. And I'm sure many of you that are a part of this webinar certainly think aligned with all of us, is that physical activity to a great extent and movement to a great extent is a cure to many of the diseases and issues that we face as a society. We've certainly seen, in stark relief what's happened during COVID as a result of being physically inactive, being sedentary, being overweight. In fact, I've said this many times, this is the first time in human history that chronic conditions have led to acute mortality. You've not seen that in modern history. So I think this is a perfect inflection point to talk about coming together to be a more physically active society. And to quote Winston Churchill, we need not waste a good crisis here. And in the interest of not doing that, myself and Tony Moreno, who will introduce himself momentarily, came up with this idea of Michigan Moves Month, and that is getting us all out of our various silos, the fitness industry, the physical educators, parks and recs, academia. Like Tony always says, we don't need another white paper at this point. We need collaboration and we need action. And that's what this month is all about. It's about collaboration and action and a jumping off point for a collaborative approach to addressing the physical activity status of all Michiganders. And that's what this conversation is going to be around. So without any further ado, I do want to have our panelists briefly introduce themselves, and then from there, we will get into the conversation. But I think the last thing to leave you with before we jump into panelist introductions is that physical activity is such an important part of a healthy society that we even have a gubernatorial proclamation from Governor Whitmer that states that May is Michigan Move Month. So, from the highest office in the state, and with Director Hertel here, representing MDHHS, we see that this is not only a priority for us stakeholders on the ground level in the community, but this is also a priority for the administration. And so we're grateful for that support as well. With that said, Director Hertel, you can begin by introducing yourself, and then we'll go around the panel.
Sure, thank you. And thanks for having me as part of this panel today. My name is Elizabeth Hertel. I am the Director of the Michigan Department of Health and Human Services.
Awesome. Deb?
Good morning. I'm Deb Berkey. I am the Executive Director of the Society for Health and Physical Education Michigan, or SHAPE Michigan. I'm a retired faculty member from Western Michigan University. I've spent the last 38 years here in Michigan looking to impact the lives of folks through physical activity. Thank you.
Clay?
Thanks, Mike. Clay Summers, Executive Director of the Michigan Recreation and Park Association. We go by mParks, so you'll see that as an abbreviation. Representing city, county, township, municipal parks and recreation agencies across the state. Around 3,000 members strong, and just happy to be here. Was a parks practitioner prior to being the director of our association, so been in the field for a little over 21 years. Thank you.
Awesome. And I will say, as an example of some of the collaboration that's already happening, I was up in Traverse City to speak on behalf of the Michigan Fitness Club Association at the mParks conference. So the good news is we're starting to gain some momentum with that collaboration. Tony?
Good afternoon, everyone. My name is Tony Moreno. I'm a professor of kinesiology at Eastern Michigan University, and I also was appointed in September to the Governor's Council of Physical Fitness, Health, and Sports.
And Tony does a bunch of other things, but we only have an hour, so we have to actually get to the webinar. Tony, I'm actually going to throw it back to you really, really quick, because I think it's important we level set with a term that I used in the title of this webinar that may have struck some people as odd and may have resonated with other people. I used the term physical literacy. So just really briefly to level set us all, can you define physical literacy in the context we're going to talk about today?
Yeah, physical literacy can be interpreted in many ways, but the most common interpretation is that of Margaret Whitehead. And her definition, the simplest definition I can provide, is that it is the competence, confidence, understanding, and motivation to be physically active throughout the lifespan. That's the simplest definition I can provide for physical literacy.
Awesome. Thank you. And good. I think that's great level setting. So, what we were talking about here, it's the emphasis through the lifespan. And you see represented on this call individuals who are involved in different elements of that lifespan. Certainly, Deb and her work with SHAPE as physical educators. I'm in commercial fitness. Clay, you're in the Parks and Rec, which a wide variety of people, and Director Hertel is responsible for the health of that lifespan on some level here in the state. So with that said, I want to get into our first question, and Director Hertel, I'll throw it to you first. Why is this such an important conversation to be having right now around making Michiganders more physically active?
I think the conversation about physical activity is always a priority because we know all of the positive benefits of physical activity from childhood through adulthood in affecting not just a person's physical health outcomes, but as well as their behavioral health and mental health diagnoses. So I think it's really important that we just continue to have this conversation. I think maybe the priority right now, it's easier given that it's sunny and it's going to be a beautiful day and it's starting to get nice and people can go outside again, and ensuring that, we do incorporate the ability of people to be physically active in all of our policy development across the state.
Yeah, thank you. And you bring up a very good point there about one of the natural challenges here in the state of Michigan is that, if you're in a state like, Florida, or you're in a state like Arizona, you can pretty much be active outdoors the entire year. There's some distinct challenges here with that in Michigan, as we well know. Hoping that we don't get any more snow here in the month of May. So certainly a challenge there, and very heartening to hear its policy importance for DHHS. Tony, how about you? Again, you're very passionate about this. You're involved in a lot of things that we can talk about, but why is this such a particular importance right now?
Well, I think it always goes back to basics, Mike. If we as a society want a physically robust culture that exhibits positive mental health and well-being, then opportunities for regular physical activity should be affordable and accessible in every sector of our society. And I'm going to provide some non-cutting edge or revolutionary news, but we all know that moderate to vigorous physical activity provides those physiological and mechanical stresses that our bodies need to adapt so that we do improve our physical fitness, and those things associated with positive mental health and well-being. So this is not new news. It's not revolutionary. It's not cutting edge. And we also know that the trends for physical activity have been negative or flat for each and every subsequent decade since the 1970s. Depending upon what sector and what survey it is that you're looking at. And we know that there's a lot of questions about the reliability of many of these surveys. But in spite of these trends or data, we can all agree that in order to address, improving physical activity, physical fitness, whatever it might be, physical literacy, we have to strive to give people those opportunities to do that, to want to be motivated and understand how important physical activity is throughout the lifespan.
And I'm going to follow up with one thing there, and I mentioned it in the opening, Tony, is that you've said to me, and I always smile when you say it, is we don't need any more white papers. We have a lot of white papers and a lot of research on this, but hasn't been a lot of action taken. Just expand on that for 1 second, and then maybe tie it into why we're all here today and here for Michigan Moves Month.
Yeah, I don't have enough fingers and toes to count the number of initiatives that have been out there to make us aware that physical activity is important. This has always been here, right? So in a sense, what we need to do is not, we've enabled awareness, but really what this is a coalition to be a call to action. We need to give teeth to these initiatives. There's Healthy People 2030, the Physical Activity Alliance, National Youth Sports Strategy, Project Play. I can go on with initiatives. And these have been in existence for some time, but none of them have teeth. And so here we have an opportunity in the state of Michigan to get a number of organizations, agencies, individuals, the private sector, nonprofits, whomever, to work together to actually give teeth to these initiatives.
Thank you. Absolutely. And we're excited to all be teeth in this process, certainly. Deb, let me throw it over to you. From your perspective, why is this such an important conversation to be having right now?
Well, thank you, Michael. Well, first of all, learning and taking care of oneself has always been critical. But the stress of COVID and other challenges in our lives have escalated the need for balance among all aspects of our lives. For me, physical activity holds a common denominator to the physical, mental, and emotional well-being. So pursuing healthy, active lifestyles includes a focus on all aspects of skills necessary to lead such a life. So it's important for the development of such skills to be intentional. Surprise, Tony, you didn't bring this up, but it's intentional and preventive and not reactional and occur in a rehab setting. So the one good thing about being COVIDed, it's offered us an opportunity to intentionally address the health of Michiganders. And I think we should capitalize on that. In educational settings, we talk a lot about whole child. I think in the state of Michigan, we should be talking about whole citizens. And how do we balance that out? And how do we take care of ourselves? And physical activity is a common denominator to what I believe we can do in terms of taking care of ourselves and making us, increasing our literacy to be able to pursue healthy, active lifestyles. So for me, it was always critical, but now it's in your face kind of a thing, and we should capitalize on that and see how we can work together to impact the lives of people across the state.
That's great, Deb. I want to follow up on one element because of the unique position that you sit in. You're talking to teachers on the ground level, every day. And, it was not too long ago, the Surgeon General came out with a statement regarding, the mental health crisis that is occurring in our youth. Can you tell me maybe what you're seeing and hearing from some of your colleagues and why physical activity plays such an important role in the mental health of our youth? We talk about physical activity in terms of physical health, but there's a very salient mental health component. Can you just touch on that momentarily? Well,
I guess I'd point one little place that I'd go right away is it's a coping mechanism. If physical activity allows us to at whatever level, I'm not talking, it can be everything from the athlete, the marathon athlete, to let's just get out and move, let's just get out and walk. But the taking care of oneself, having the capacity to reduce stress through productive, something simple like physical activity, I believe is that it sounds so simple, but we make it so incredibly hard because we make excuses about why we don't have time to do physical activity or why. Well, this for me, this is a take care of ourselves, manage stress, cope with stress, keep it simple. Utilize physical activity for I feel better, Maybe I'll look better. I can utilize it for goal setting. Tony talked a minute ago about moderate to vigorous physical activity. We give a lot of lip service to, yeah, CDC tells us to do this, this, and this, but we actually have a metric that we could utilize through physical activity that not only we can measure our intensity levels, but also how that makes us feel in terms of, like I say, taking care of ourselves. And we have some actual data that we could utilize. But for me, the wellness of a person, being able to balance that is all tied to how much time do I spend with each sector of my life? And one of those needs to be tied together, in my opinion, with physical activity, because it impacts all the other ones, all the other aspects.
Yeah, very, very well said. And I want to highlight something that you did say there. We are being very intentional in our terminology here. We didn't call this Michigan Exercise Month. We called this Michigan Moves Month, and movement and physical activity is what we're talking about. Exercise, which my industry is broadly involved in, it's a subset of physical activity. And I think what Deb said there was very important, is that sometimes we make it too complicated. Sometimes, just going for, a walk in the park is as beneficial, if not more beneficial, than going in the gym and pumping some iron. And so with that as a natural segue, Clay, I'll throw it to you. Why do you feel this is such an important discussion for us to be having right now?
Yeah, and Mike, I appreciate everybody's comments, and I kind of nodding my head a little bit, and Deb just said it, it's keeping it simple. I think the reason is because it's the right thing to do, right? It's that simple. It's the right thing to do. We need to have a physically active state. I think the folks in my industry from the parks and recreation world, we're brought up as community servants, right? We work within our community to make it a place where people want to live, work, and play, kind of thing. That's kind of the motto behind what our members really try to promote. And so to have a physically active community makes for a healthy community. It makes for a place where people want to be and gather. So all of those things become easier as you're promoting that as a community benefit. And I think it really is, I break it down to as simple as I possibly can. It just really is the right thing to do. And through the pandemic, we've seen, folks who are non-traditional movers getting out. Either going, now that we're back open, going to gyms, or we were always open in the outdoors, making parks a priority and a space where people could go and be safe. So I think our real goal now is to continue to capitalize on that non-traditional user. And the challenge is going to be is how do we keep them engaged? But I really think it goes back to, it really is this as simple as it's the right thing to do. I mean, to be healthy, to be active is fundamental to lifespan. And so I think that's kind of where I sit. And certainly everybody's comments resonate with me very, very well. So
awesome, thank you. And I'll kind of tie all this together from my industry's perspective in the commercial health club industry. You said that the non-traditional user or non-traditional mover, if we want to put it in this context. And I think one thing that my industry has came to realize is we only serve 20% of the population. The other 80%, we do not do a great job of serving them. And there are lots of reasons, which can be its own webinar. But if we are truly looking to impact population health broadly, both physical and mental health, to Director Hertel's point initially, I mean the mental health benefits of exercise are more salient and more immediate even than the physical health benefit of exercise. If we are truly going to effectuate that kind of change in public health, we absolutely have to get to that other 80% of the population. And this is the reason why all these stakeholders are a part of this conversation, because physically active youth that go through good physical education programs that are taught by the spectacular people that Deb interacts with are people that eventually become members of health and fitness clubs, are people that utilize parks and recreation departments And so it is very, very important that we think broadly, not about how we engage the people who are already active. And as the statistics will tell you, here in the state of Michigan, about 1 in 2 Michiganders meet the CDC's recommendation for physical activity, which is that 150 minutes of moderate to vigorous intensity physical activity per week. That drops to about 1 in 4 when you add in the muscle strengthening guidelines. So when we're thinking of this, and I realize there's a number of different individuals that are listening to this conversation. So if you are someone who works with the broader population and you're looking to make them more physically active, I think one of the things you'll hear as a theme here as we go is let's not focus on the people that are already active and already fit. I say that largely to my industry constituents that are on this call. We've been making the fit fitter in the fitness industry for a very long time. And while that's great, we need to think more broadly in terms of its impact on population health. So as I said, to that Churchill quote, no time to waste a good crisis. Now is the time for us to all really come together. And with that said, and Tony, I'm going to throw it back to you first for this. Why is it so important that we collaborate, rather than just kind of do this in our own, focused unilateral way? Oh, you're muted.
Thanks for the reminder. As I indicated earlier, there are various sectors. There are 9 sectors affiliated with the Physical Activity Alliance, the National Physical Activity Alliance. And each of us on this call, and I'm sure those of you that are listening in on the webinar, represent different sectors. And I'm embarrassed to say that I did not know or acknowledge that May was also Mental Health Month. I don't operate in that silo. Mm-hmm. And so it would have been fantastic to have been aware of that and include that as a very big piece of this Michigan Moves Month. So we'll be better prepared next year, obviously. But again, it would have been tremendous to know other people and what they're doing in their respective silo. A rising tide raises all ships. We can all work together to create collective impact, to push that needle in the positive direction. And here we are talking about awareness, but just as important is the action piece, because we know that there are schools that are lacking for physical educators or physical education facilities. We know that there are opportunities for community parks and recreation to provide some of those facilities and resources for schools. And we also know the private sector and the nonprofit sector who have personnel that are qualified as it relates to physical activity, sport, fitness, health, whatever it might be, can work within the umbrella of these parks and recreation facilities and school facilities. So the next step when we talk about action is to actually create these frameworks where everybody in their respective sector or their community has a way of gluing together and combining all these various sectors to work together to provide the appropriate programming that is both, as I said earlier, accessible. That's very key, accessible to every Michigander of every ability, but also affordable to every Michigander as well. And so that's why it's important to talk to each other, because we can help each other. We have a cause. We know that it's an important one. But the next step is to take action. And so we have to move towards creating these frameworks and having these discussions after today as to how that's going to happen.
Thank you. And that's one thing that we've all said is that this is our springboard to annualized programming. And this is the first annual Michigan Moves Month, and the other 11 months out of the year, we are going to be doing things. And you also said something about just awareness. And myself, you, and Deb, I mean, I can't tell you how many times we were having conversations where another organization came up that we'd never heard of before. And we almost shook our head and, we need to talk to this group. So it is on some level kind of amplifying that voice. Deb, from your perspective, why are all of us coming together so important?
Well, our collective fields impact the lives of Michiganders from cradle to sunset. It's another way of saying a different thing, but it's cradle to sunset. And, we all have a part in this, but working together, we can provide more cohesive programs, products, and services that people can use as resources that they're available to them, and we can be more effective. I mean, we're all effective in our own little way, but working together, we can, instead of competing for the attention of our constituents across the board, we can focus on a clear message. And that clear message can be reflected, not only reflected, but also shared. And so if I'm doing something that, if I'm already doing it, why are we doing it again over here? Or why are we doing it again over here? Or, you know, it's interesting you say, Tony, well, it was also Mental Health Month. Well, there was also Nurses Appreciation Week, and there seems to be a holiday for everything. Let's have a holiday for, let's focus collectively on health and physical, in my mind, health and physical literacy, because they go hand in hand, so that we provide the skills, the opportunities that people actually apply them, whether it's in the gym, whether it's in the park, whether it's wherever it is. I view the educational piece as, okay, we need to be aware of what we're preparing them to do. And so working together makes sense, as opposed to working as a collective, as opposed to the silos. And we can also share resources, and heaven knows resources are hard to come by. So instead of competing not just for attention, but also the resources, let's look at how we can work together. That's why I believe it's so important. There's only so much time and so many resources for us to, if you will, compete for. Let's stop competing and start cohesively looking at, well, what's the real problem? What's the real issue here? And the issue is the health of our constituents, and let's work together to do that.
Yeah, absolutely. Clay, I'll throw it to you.
Yeah. Again, I think collaboration is the key to this whole thing, and it's going to be difficult to say more than what Tony and Deb have already said, but I think collaboration is knowledge for me. So every relationship I make, whether that's with another association, or for that matter, Mike, how you and I kind of met through a person of mutual knowing that person and getting connected, really has, you know, fostered a great relationship and helped me to understand more about what's going on. So in my, you know, we've always said in our world at mParks and in our association, we try to be connectors and conveners and really attach ourselves to folks that have similar messaging. It really helps to amplify our voices together. It gets us in places that individually we can't necessarily go. And I think this is an important enough issue that we need to be in places that we can't go individually as orgs or as people, to be able to knock on doors and to be able to really, Mike, to be quite honest with you, pull this off so quickly. That's because of the collaborations that were already created, right? I mean, this happened really fast. And surprisingly to me, it happened very fast. And so I think that's the power of bringing different groups together. And that's why it's so important. I mean, for just to wrap that up, it really is about finding the right people to put in the room, to massage the messaging, to make sure that it fits all of our platforms, and then we go, and together we are so much better. We've all been in places where we've operated individually, and like you said, I mean, we're seeing the chats come up, you know, right now, seeing things kind of blasted. I didn't know that. Well, through this collaboration, now we know, because we're having this webinar. I mean, it's creating that conversation that I think only, you know, multiple groups coming together can really raise up. So I just, again, simple, it's the right thing to do. We all need to not be so protective of our own individual, you know, visions and missions, and really look at it from a state perspective.
And, you know, Director Hertel, I'll throw this to you from your perspective, kind of looking from the top down. Maybe it's less so what's so important about the ability to collaborate, but maybe more so the question is, you know, what excites you to see, you know, this type of collaboration, you know, taking place, and any other perspective you have on it.
I think when we start talking about our health outcomes, you know, in Michigan or anywhere across the country, every everyone is talking a lot more about those determinants of our health outcomes that occur outside of our physicians' offices or our hospitals, and recognizing that so much of what we encounter on a daily basis has an effect, whether positive or negative, on those health outcomes. And the ability to be physically active is absolutely one of those things. And I think that the discussions about collaborations from childhood through adulthood, from schools to communities, is so important. And I'd also encourage further collaborations, particularly with law enforcement, housing development, community city planners, where we talk about the opportunity to be physically active without having to plan for it. Being able for kids to walk to and from school in a safe neighborhood, being able to walk to and from a store in a safe neighborhood. Those things that really make it easy for us to be physically active and incorporate those things into our days. And I think that is becoming more and more of a priority in discussions. And I'm really encouraged when I talk to many different groups, including this one, to hear that increased interaction with your partners.
Yeah, and you bring up a very, very good point around making physical activity, the easy choice. And, your environment to a great extent does dictate, the things that you do during your day. We are indeed, products of our own environment. So I think that that's an excellent point. And so it seems as if as we expand this, getting those people that are involved in that built environment piece also becomes, with mParks and other stakeholders, becomes critically important. So I think I want to move on to kind of talk a little bit about, currently kind of what all the different organizations are doing. And Elizabeth, I'll throw it back to you right off the bat. I'm curious, from your perspective in MDHHS, what are some of the things that you guys are doing or strategizing to try to improve the physical activity status of Michiganders?
We continue to encourage physical activity through a number of our program collaborations in the department, in our public health administration, in schools, with YMCAs, continued partnership and recognition of the Michigan model, but also through our collaborations and our contracts and partnerships with our payers, our managed care organizations in Medicaid, to ensure that people do understand how important it is to be physically active, how much of an effect that can have on chronic conditions, especially when we talk about things in particular diabetes, heart disease, and those sorts of activities. So we've got internally great collaboration between our administrations, with our public health folks on chronic disease and Medicaid, and then externally with a number of other groups, to make sure that we don't often have the opportunity to be the only funder or supporter for many of these programs. And so we are able to partner with other organizations to make sure that we can continue to support those sorts of programs, specifically targeting, again, in schools, in areas where we may have disparities in health outcomes in general, and then, of course, in our medical environments with people who have multiple chronic conditions.
Outstanding. Yeah, very, very encouraging. And Director Hertel brings up the point there of the social determinants of health on some level, and trying to work against this whole notion that on some level your zip code does dictate your health status right now. But if we can move away from that type of a problematic situation, it's much better for the overall health of our society. And that does take top-down policy level interventions like Director Hertel's talking about, but that also takes that bottoms up, grassroots approach. And, Deb, I'm going to throw it over to you next. Talk to us about some things that, SHAPE is doing right now that they focus on strategically.
Well, we focus primarily on the provision of professional development and resources for health and physical education teachers, coaches, administrators, and allied groups. We try to bring them state of the art, for example, webinars, professional conferences, face-to-face, networking, mentoring, special, as far as we've got a pretty extensive information distribution. Want them to know exactly what's happening. For example, how does MyKIP, how does that fit into what they're doing in their schools? How do they utilize that to leverage health and wellness within the confines of schools? We provide that through online programming, like I said, face-to-face programming, but we also provide grants. We're working with several different partners to make available, hey, here's some funding that you could utilize to impact the lives of your children through provision of curriculum or tools like heart rate monitors or other types of equipment. We try to be a clearinghouse. My goal is always to provide professional development year round for teachers, and also to, how do I want to say this, encourage them to work collaboratively with their administrators, with their parents, with the communities to impact the lives of children. So we're professional development, all things that we can find to promote, all things that we can find to provide, all things that we can do to set our teachers up to be effective, because if they are effective, then that'll impact the lives of their children, and their students, and that will impact their capacities to lead healthy, active lifestyles. So it's all about the kids, but you got to back it all up and backfill, and what resources can we provide to them so that they can effectively carry that out.
Awesome. I appreciate that look under the hood. Clay, talk about some of the things that are happening at mParks.
Yeah, this is my favorite stuff to talk about, is the stuff we're actually doing within our organization. And there's quite a few things, and I'd highlight one really nice partnership that we have and have had for multiple years with Blue Cross Blue Shield of Michigan, the Department of Natural Resources, and mParks, called My Big Green Gym. And that's really promoting the outdoors as your big green gym space, where people can be physically active, looking at your community to find out what they provide in those outdoor spaces. And that's a long lasting relationship that we've really grown over probably the last 10 to 12 years, and has really been something we're very, very proud of. We've done a lot of work with the Department of Health and Human Services, as far as being involved with grant programs in the Building Healthy Communities program, and currently have a partnership with MDHHS and the Office of Outdoor Industry, Brad Garman's office at the state, doing some activation grants. So looking at locations across the state, as we've talked about, that maybe are a little less physically active based on zip code, and really targeting those areas with some financial resources to help build on either an activity that's already going on, or to provide accessible equipment, or to provide transportation for kids or families to get to those activities where they may not have access to that. So that's really a couple of things that we're looking at. One of the big national pushes for the audience is really that 10-minute walk to a park. So trying to put parks in every community within a 10-minute walk of your home. It's a really ambitious goal when you look at the scope, but really making it, and again, that goes back to accessibility. You don't have to own a car, you don't have to have a bike, you don't have to be able to afford an Uber or a cab. You can literally put your tennis shoes on and walk to the park and be there within 10 minutes. And I think those things are really important. And like Deb, we're also really education based for our members. So conferences, through our conferences, there's constantly a focus on wellness. Hence, obviously having you at our last conference, Mike, to speak about partnerships and that whole thing. And we've really made that a consistent position on our board. We've appointed somebody to our board that has a health and wellness background, and that currently is actually one of Director Hertel's staff. Linda Scarpetta sits on our board of mParks, and has been just super helpful in kind of enlightening our members, and which they can take back to their community on what's going on at the department and how it fits with mParks. So lots of exciting stuff there. I could go on and on. Our foundation, we have an mParks Foundation that does a Play is Essential grant. So it really provides funding for communities to buy accessible equipment again, to help offset, those communities when they can't afford that, or provide, small infuse of cash to help folks. So again, quite a few things happening. Super excited about all of those things.
Yeah, that's great. Yeah, and there's far more going on, I know, from just talking to you than what you can say here in the short time we have. And Tony, I'll throw it to you kind of as a wrap up to this. You see the ecosystem as a whole. You kind of sit in a slightly different position than the rest of us that are on this webinar. Talk to us maybe about what you're seeing out there that excites you the most.
Well, obviously this webinar is a first step, and I think I just want to make it clear to the panelists and those of you on this webinar, what I don't want this to be is just a warm shower where we pat each other on the back after we get off the call and then we go about our daily business. This is something that we need to perpetuate and be aggressive with. If we're really good at talking the talk, but we're really lousy at walking the walk, as it is. And I'm on the Governor's Council of Physical Fitness, Health, and Sport. This was established 30 years ago. And the purpose of that group was to improve the health of increased physical activity among Michigan residents. So we're appointees from the governor of Michigan, and ready to act as a catalyst and as Clay indicated, as a convener to increase, enhance, illuminate the awareness, action, and accountability needed to promote physical activity among all stakeholders in Michigan. So this webinar in and of itself is an exciting catalyst to keep things moving forward. And so I currently serve, as you indicated at the top of the call, I do a lot of little different things on the side. And I've been working with Kristen Martins and the Michigan Fitness Foundation and their physical literacy leadership group. But the Michigan Fitness Foundation is another organization that has a tremendous number of excellent resources for physical educators, individuals that work in the parks and recreation community, nonprofits, private sector, a number of tremendous resources. And the exciting thing would be to make people aware of these resources so that they be used at home, in a community park and recreation community, in a school. So what's exciting to me is the opportunity that we have all come together to create or generate this collective impact that's needed. And it's important after this webinar to keep that discussion moving forward. Rather than oftentimes what I see in academic settings, somebody presents a paper or an abstract and they pat each other on the back, they go have their beer and they say, see you next year. We're not going to really initiate any change if we approach this in that manner. So what's exciting to me again is that everybody's here on the call, and that's great.
Thank you, Tony. And I'll just add, briefly, that from my sector, that collaboration is very heartening, and the things that we're starting to talk about in terms of how we get to that other 80% of the population, how we change the language away from just exercise or things like like a boot camp or things that are really off-putting to the population at large, and say, how do we become more approachable as an industry? And I do really feel like we are moving in a very, very positive direction just by having this conversation. But your point is well taken. It cannot stop here. It has to continue after this moment. Well, we're coming up on the time where I want to leave it open to take a little bit of questions. So I think we're going to move to our last question for each of our panelists. And Director Hertel, I'll start with you. And it's going to be a two-part question because you sit in such a prominent role in terms of the health of Michiganders. The two-part question is this, first off, what would you like to see from all of the physical activity stakeholders in the state as the Director of Health and Human Services? And then the second part of that question is, what would you like the biggest takeaway for everyone from this discussion to be?
I think I'd like to continue to see the collaboration, the relationships developing outside of the traditional physical health space, and with some of those other policy making groups having to do with planning, long-term planning, to create environments that physical therapy, the choice to be physically active is easy and safe for people. And that, I think, probably number one is what I'd like to continue to see. The biggest takeaway, I think, is just the continued discussion about the importance of maintaining physical activity in a person's life, and without having to go with those kind of scarier, phrases like you mentioned, a boot camp or a marathon, or, just go for a walk, walk up and down the stairs, do these things that we know are helpful, especially in a society where we weren't that physically active to begin with. And now many of us don't have to leave the house as often as we did previously. Our screen time is upped because of the way that we're working. And so learning how to incorporate physical activity into this new lifestyle, I think, is incredibly important.
Yeah, yes, yeah. Access and approachability. Very, very well said. Thank you. Deb, what about you? What's the big takeaway that you would like people to have from this conversation we're having today? Well,
wherever you are, whatever it is that you're doing, whatever your role is, your professional contribution, your involvement's critical. We need a critical mass. And I guess just to put it as simply as I can, what's your organization doing? Is anybody else doing it? How can we work together? Because to me, the takeaway, we know what we want to do. We want to impact the lives of people through physical activity. We want, at least that's what I want to do, want to increase their physical, their health and physical literacy. Okay, what am I doing? And what's everybody else doing? And how can we work together? And as I would say, this is a cold shower, Tony, not a warm shower. The cold shower is, okay, wake up, let's go. We got to figure out, quit talking about it. How do we make some plans, small maybe at first, but how do we gradually pick up momentum to impact change as in working together to get to our goal?
Awesome. Clay, same question to you. What should be the big takeaway here?
Yeah, I think folks need to understand that they are a part of the overall solution, and don't assume that your role isn't important. I think it really, if you're on this call, you've got a passion to listen to the conversation and to be a part of the conversation. And I think reaching out and just understanding you're not alone to organizations where you don't feel intimidated to pick up the phone and call somebody, to introduce yourself, to talk about what your organization is doing or what you're doing individually. And I think those are some of the things I would want folks to understand, is that if you're on this call, or if you were, know somebody that's on this call, like, connect with one another. I mean, the conversation has to start somewhere. We need to continue these conversations. And I think it all comes back down to communication. And just educating ourselves about what one another are doing, and being open-minded enough to share your missions and visions to others, to allow that conversation to then take on a little different path, where it's not like, this is what we're doing and only what we're doing, but be open-minded to what others are doing. And I think if we did that in society as in general, we'd be in a lot better place, both politically and whatever. But I think just being open-minded to the overall conversation and not assuming that you're not big enough fish to be a part of it.
Yeah, very, very, very well said. And I think that, it is so critically important that people understand that they are all part of the solution to this massive challenge that we face of becoming a more physically active society. It's interesting, in my industry, we always used to think that the health and fitness club down the street was the competition. But now we realize that the real competition, is the remote control, the highly processed foods, the couch, the screens. And so I think it's this realization that, we are fighting a larger enemy than what we thought, and that's going to take a large army to be able to address this massive challenge. Tony, to you, biggest takeaway.
Well, I think we can all agree that since the 1970s, we are becoming more and more physically illiterate. rather than physically literate. And so that means we have a population that does not have the competence, is not confident, does not have the understanding, nor are they motivated to want to be physically active throughout the lifespan. So we have to try to change that narrative. And when we think about, well, where does one become a confident mover? Where does that happen? Does that happen at home? Does it happen at work? Does it happen at a park? Do we do this in schools? Where does that happen? Where can we all agree upon where that's going to happen? And I applaud Director Hertel because she has a very daunting task in trying to maybe perhaps change the culture of an entire state. That's not an easy thing to do. So all of us, again, collectively can work together to maybe help or assist in whatever way we can to help change that culture. That's very important. So to me, the key takeaway here is that when you go back and you get off this call, you go back to your community, to your workplace, to your sector, to your setting, or whatever it might be, think about how you can collaborate with individuals in your community to try to create a more physically literate culture where people do have the opportunity to become competent, whether that be through quality physical education or community parks and recreation programming, or in nonprofit, or in health clubs and fitness centers, wherever that might be. How do we enable them? We need to be enablers, enable them to acquire movement competency so that they are more confident and they are exposed to a diverse buffet of movement opportunities. And the other thing is they understand. How do we educate people in a way so that they understand physical activity is an important part of their life? And the motivation will fall in place, and many of the other things that we speak to will fall in place if we can do that. So the key takeaway here is for everybody to think about how they can operate in their community to create a more physically literate culture.
Yeah, and I think I'll piggyback on that to say, we need to think about it. And then my big takeaway is we need to take action. Ultimately, we're talking about physical activity and movement here. We're telling people to get up off their feet and be more active. Well, I think for us as a public health and an activity community in the state of Michigan, we need to take action on this. I think conversation is great, and we need to have some of those foundational conversations, but taking action, trying initiatives. Clay mentioned this earlier. This came together very, very quickly because we were just willing to give it a try. And sometimes, perfect is the enemy of good. And this first Michigan Moves Month is far from perfect, but it is a great start for us. And so I really, truly believe, that taking some massive action after this will lead to positive things, and will be an iterative process that will allow us to become more active as a state progressively year over year. Now we have about 7 minutes left. Before I open it up to questions, a couple of just housekeeping notes before people first start dropping off. The first thing I want to acknowledge is Director Hertel's presence here. All of us, this is kind of our thing, right? Like, this is our day job to promote physical activity and movement and exercise. I can only imagine what Director Hertel's day job is like. And so Director Hertel, first, thank you so much for being here representing DHHS and the governor's administration. We couldn't be any more thankful that you and the administration views this as important enough to be a part of this conversation. And then certainly to our other panelists, I wanted to thank all of you, Tony, especially you for help, you and I putting this together through this labor of love these past couple of months. As far as information to share, I know there's been some questions in the chat and also in the Q&A feature. We'll be sending out the recording of this webinar afterwards, so everyone will have access to that. If you do want to get in touch, with any of the panelists, Clay, Tony, and Deb, I can make sure I facilitate that. There are different mechanisms to get in touch with Director Hertel through the state if that was something that you would have interest in. Also, I know there are some media members that are on this webinar. If there are any questions that you have and you need to follow up, my email is in the chat. That will actually go out in the email afterwards. So if you need to follow up with me, more than happy to have those conversations. And to the media members, I will be available today and tomorrow for any comments that need to be had. I did see one question in the chat by Dr. Deanna Lights from WWJ, and I think it is a great question to answer. Deb, you typed out the answer, but I'll just give the answer, verbally from my perspective. And it probably is going to bring this to a close, given the fact we only have, 5 minutes left. But the question was, what does this actually mean for Michiganders? That was the question, and that is a legitimate question to answer without a doubt. And I think that this means, put frankly, that we now not only realize the importance of this from the bottom up and the top down, but we are here to do something about it. The goal of this initial Michigan Moves Month was to put on the radar of lawmakers, public health officials, medical professionals, and the media that we're all coming together to address the physical literacy issues that exist in the state. So this means we are laying the framework in a non-siloed, non-fragmented way to actually move the needle on the physical activity status of Michiganders. I can assure you that everyone that is on this call right now wants that to go from 1 in 4 that don't meet the total requirement for physical activity and muscle strengthening to 3 in 4 meet that, and only 1 in 4 don't. And that is a goal that we can move towards, and we can move towards together. So I think, Dr. Lights, the take home from this for everyone is that we now have a coalition that's going to be working together annually, and this coalition will be able to put multiple initiatives in place that are both approachable and accessible, and then to use Deb and Tony's terminology, from cradle to sunset of life, to make sure we address the full spectrum of physical activity needs of all individuals in our state. So with that said, we have 3 minutes left, and I'm not going to attempt to answer any question in that 3 minutes. In fact, I will do what seems to be the appropriate thing right now and say, with the 3 minutes I am giving you back, get up, go outside, and go for a walk. I want to thank everyone for joining us for this Michigan Moves Month, first Michigan Moves Month webinar. Look for the email coming up afterwards. Any more information on Michigan Moves Month, you can email me. My email is in the chat. I appreciate everyone joining us, and get out there and get moving. Thank you.